I'm Alfred Bayeton, second year medical student at William Carey College of Osteopathic Medicine. I worked in the pediatric ER before starting school. And it's where I became familiar with child life specialists and the role they serve in helping sick children. I thought it'd be cool to do this interview to highlight their work and show the public who these wonderful people are.
Hey y'all, I'm Kelsey. I work at Children's of Mississippi in the Pediatric Emergency Department. I am a certified child life specialist. I went to undergrad at Mississippi State. I went to graduate school at Texas State. I did my internship at UCLA. I did my practicum here, and I came back here to work. And I've been here for about 1 year.
Kelsey,
Hey, Alfred.
thanks for being here on Sunday.
You're so welcome.
Because you're not going in for like a couple hours.
Oh no, after this I'm starting my day. I will be flexing my time today.
Nice. So Kelsey here is a child life specialist
Yes.
in the emergency department, pediatric emergency department.
Yes.
Why? So there are other specialists in...
Yes, so we have a hematology oncology specialist, we have a cancer clinic specialist, we have a PICU specialist, imaging specialist, a pre-op, post-op surgery specialist.
For wherever kids are at.
Yeah.
You know those memes that say like what my friends think,
Yeah.
what my parents think, and then what I actually do?
Correct.
So to say that child life specialists, all you guys do is hang out and entertain kids. It's like saying a boxer, I'm just gonna punch.
Yeah.
A chef just cooks.
Yeah.
That's
Yeah, there's more to it, for sure. So for education stuff, like you have to have a bachelor's degree in like child development or psychology, and then you have to have 150 hours for a practicum, which is kind of observation, and then you have to have an internship, which is your clinical hands-on experience, which can range from 650 hours to 800 depending on the program. And then I also got my master's.
So you went to Mississippi State?
Yes, went to
National
Mississippi State.
champs?
Hey, go Dogs.
So Mississippi State,
Yes.
and then you got your master's
At Texas State University, yep, in
Nice.
child life. So yeah, there's a lot more to it than just playing with kids. We use a lot of evidence-based practice, a lot of research, theorists, like background in theory to, lead our practice. So there's a lot more to it than what people think.
Because why? What is something you like? People don't expect that you need to learn that long. With what is that?
So a lot of it is you learning development. So
Okay.
learning what a kid understands at each developmental stage, whether they can understand concrete language, if, they're in that magical thinking stage, how do you need to approach that?
So in the ED,
Mhm.
I had to strap down. Gently hold down
Yes.
kids for IVs and procedures,
Mhm.
right? So, are you saying that is that why a 7-year-old we talk to them differently than
Yeah,
say,
so look, we can avoid most of the time having to hold someone down for an IV. A lot of the times
really?
the kiddo is just scared because they don't know what's happening, and someone didn't really explain it. They just see 5 people coming at them
Coming in
and
hot.
holding them down, and they don't know what to expect. That's kind of where child life comes in, and I can bring in my little straw and show my little straw
Yeah,
to
what
them.
what is this straw?
So this is an IV. This is the catheter. So when I introduce IVs to kiddos, I do it like this first. This is my straw because this is not that threatening. If I come in with a needle, they're going to say, oh, no, I'm done. But if you come in, this is my straw. This is how I get medicine. This is how it's going to make your body feel better. That kind of stuff. Going through, these are my blue lines. These are my veins. Veins carry what? To your whole body. That's how our medicine,
But then only certain ages, like you don't talk to a 4-year-old that way. or-
Right. So for a 4-year-old, I still bring out the straw.
Okay.
But, I'm not going to go into, do you know what, blood's going through your veins and, medicine, but I do talk about this is your straw and it has a magic button that's connected that we can give you medicine through. And this will help your body feel better. And then with a 4-year-old, I will have a doll or something and I can show them exactly. So right here we have an Avengers. I can bring a Barbie doll or an Avengers or a teddy bear and do medical play with that kiddo, and we can give an IV to a teddy bear and they can help me with it. Tie the blue rubber band tight on them, clean, clean, clean. And, I go through all of those things with 4-year-olds so they can feel it, feel the tourniquet, blue rubber band, feel the cleaning so they know what to expect.
And not just okay.
Yeah.
So you guys are part of the medical team, right? So you guys, you guys never wear scrubs.
Well, we wear scrub pants, but we wear t-shirts, yeah. So a lot of times we'll wear colorful t-shirts or just plain t-shirts. Kind of the reasoning behind that is we want to look a little bit more normalized to a kiddo. Sometimes there's white coat syndrome where a kid sees someone in a white coat and they're like, ah!
Or a scrub syndrome, I guess.
Yeah,
right?
well, it's a little less threatening, and that's kind of our job, is to normalize the hospital environment and make it more kid friendly. So, and we want to build that rapport and that trust with all of our patients so they trust what we're saying and we can help them through their hospital experience. So it's the little things we pay attention to.
And something that you never, the lay person would not think of.
So every time I walk into a room, I say, "Hey friend."
And
I call them friend, so they know, like, I'm here to be there for them.
So do you think the comfort that you guys give, is it not the same as a nurse or the other, like, members of the team?
I think it can be. I think we just bring a different element to the multidisciplinary team.
Okay.
Because we do have that, we are developmental specialists, so we know, like, wording, phrasing to help the child understand no matter which age or developmental stage they're in. And some physicians and nurses, they don't necessarily have that training. That training, they're focused on helping their physical health a lot of times. And we do have great nurses and physicians that love on these kiddos and try to make it the best experience for them and their families. But the training that we have just adds that extra layer to really focus on that psychosocial level.
Gotcha. Nice. So on you're going home and it's you had a rough day. Who or what is usually the reason you had a rough day? Is it the parents difficult, the patients, or just?
So there is a lot of hesitancy for some physicians, nurses, and other people to, like, come into peds.
Yeah.
Because
they said their parents.
Parents are the gatekeepers, is what we call them. Parents, allow what we can and cannot do to their kiddos. But I think the important thing to remember, and what I always have to remind myself, is there's so much outside of what I know going on with this family that I have to, like, take into consideration. So if a parent is getting angry, agitated, they're having a bad day, and they're in the ED, they're scared for their child. They don't know what's happening to their kid. They want to help it, but they can't. We can do that. So they're just nervous. So they ask a lot of questions. Sometimes they get agitated with us. And I just have to remind myself and sometimes staff, like, they're just scared. And they just want to help their child.
And it comes off just a bit, not the most pleasant, but
right. But they're just trying to take care of their kid, and they're just nervous. And sometimes when you're scared or nervous, it can come off like you're agitated or irritated, but really you're just scared. So anytime I'm working with a parent and it's kind of a difficult, situation, I just have to give grace.
Okay.
Because there's a lot of outside aspects that I have no clue about.
Oof. Your patience, Kelsey, very admirable. So let's talk about these toys.
Yes.
So these are the tools of the trade
Yes.
of how you carry out your child development.
Yes.
So let's which one we should grab first?
So we can start with whatever, but everybody thinks toys are just to, fun, play with for the kiddo, but there's actually dual purpose.
Okay.
So as child life specialists, we're thinking of your development, keeping you developmentally on track or progressing your development while you're in the hospital. Or we're trying to encourage you, incentivize you to meet your healthcare goals. So for example, we talked about medical play with our Avengers or our Barbie dolls, which are great. But dinosaurs, collecting dinosaurs and doing a dinosaur scavenger hunt.
How crazy these kids know all these dinosaur names.
They know all the names. So using dinosaurs, we can make a dinosaur scavenger hunt, which helps a kid get up and ambulate. If that's a goal after surgery and we need to get them to walk, the nurses is like, we can't get them up. That's where we come in, and we can do a dinosaur scavenger hunt. And as they collect dinosaurs, they get to keep them.
Oh,
so they want to
okay.
get up, they want to go find them. So that's a, dual purpose. We're playing, we're having fun, but we're also meeting our medical goals. The doctor play set is just sensational for child life no matter what. Because remember, we're trying to normalize the hospital environment. So,
look at this.
yeah, you got your stethoscope, you got your thermometer, you got your, reflex hammer. We don't really use this in the ED, but hey, why not? You got your tongue depressor. So,
makes them feel like they're
it gives them
their version of the adult
right.
stuff.
So play is the universal language of children. That's how they process their emotions and things that happen through them is through play developmentally. So having doctor play sets, we can play out a scenario that they might have gone through, and it can help them cope better.
It's like, that's what I have. You have
exactly.
The same thing.
So like, say a kiddo had a shot, we can bring in a teddy bear and we can let them give the teddy bear shot.
Ooh,
and then we can
poor Teddy.
right, and see how they react with that teddy bear. Maybe that helps let us know how they're coping. Is a teddy bear scared? That means they might have been scared.
So they're them projecting it on.
Play is the way they go through emotions and life things. So like, we can interpret that and kind of work with them through that, and then help their coping.
That's kind of cool. That's really cool, actually.
Yeah.
And then we have
Legos.
This is the
Legos are the best things ever.
This
We need
is
all
the
of them.
sought after.
Yes, especially girl Legos.
Oh, girl Legos?
Yeah, girl Legos, because, everybody always gives us, which is great, boy Legos, but we need girl Legos too. Girls like Legos, I like to build. Legos are great for those fine motor skills in their development. Some kiddos that might have been in a car accident and or might be working through with PT and OT and working on those fine motor skills to regain those muscles. Legos is a great way to do it. It's play, it's fun, but we're still getting those skills.
So, what about the ages? And it ranges like
it does, and you can get bigger sets for older kids. That's more advanced. That takes a little bit longer, which is a big deal right now because with COVID and RSV and all this stuff going on, a lot of our patients are having to stay in their room under isolation, and so our playrooms aren't open. So
still not okay.
Yeah,
even
yeah.
Okay.
So Legos are a great way to keep them occupied while also working through development. And also those fine motor skills, and it keeps them for a long time. So if they have a big set, it might keep them occupied for, a couple days, which is great because they might be here for a while and they can't really get out of their room. So we love Legos.
Legos. Fantastic.
Yes.
Let's see.
We got this baby VTAC toy. Can you see it? We need all the baby toys. So we have a lot of babies in right now with RSV. That's kind of a big thing going on right now. So really encouraging them to keep growing in their development, providing those toys is a huge thing. And a lot of parents come in, say they come through the emergency department, they learn their kiddo has to stay the night. They don't have toys with them. They didn't think to bring it.
Yeah, wow.
Right. And
so wait, so when you give these toys away,
that's theirs.
Oh. Okay.
That is their toy.
It's like shop.
Exactly, and it helps with incentive too. But yeah, we love baby toys because babies can get so bored in the hospital, and so we always love to have them toys, keep their development going, but also keep them engaged in something.
Nice. So you talked about you guys are there for procedures, for comfort. You're there to maintain their developmental processes. One thing you guys also do is they're not so like the uglier side, I guess, right? So this was, and I remember this was 2019. It was I don't think you were working there yet, but it was a Saturday, and Joe Burrow, good old Joe, he had a huge game, and it was kind of funny that we thought that it's Saturday.
It's gonna be a chill night.
We're gonna have to watch a game, and then all of a sudden, Kelsey, I'm talking about Armageddon.
That's usually when it hits.
And that was the sound of a mom when she realizes her she has outlived her child. It's like a very audible.
You can't really describe it.
You can't describe it, but I noticed it because I heard it multiple times during the shift.
Right.
And besides the nurse and the doctor were there, Child Life was there.
Yeah.
So tell me, how does that? What is your? That's so much sadness, you know.
Right.
When you go in that room, what is the goal for the interaction? How does that usually?
My goal is really to make them, the parent, the caregiver, whoever just lost that child, giving them a safe space to grieve and go through those emotions. You know, validating their feelings. This is hard. This is sad. I'm so sorry for your loss. Just being there to listen to them. I don't have to talk all the time. Sometimes silence is the best thing. Just being there, having a comforting hand on their shoulder, getting them tissues, just walking with them through one of the hardest moments of their life, just being someone of support, you know. And also kind of what we do as well, if it's appropriate and age appropriate, we try to, you know, give them resources about the grief center, if they have other kiddos, you know, if they do have other kiddos, explaining, you know, how you can explain death to those kids depending on their ages and developmental stage, because it differs on their understanding.
How do you cope with that? Because it was like one room, and then you're needed somewhere else, and then you're needed again, and the next room may not understand, like, and they're yelling at you, or like they're not yelling, but they're demanding your attention. How do you personally?
You just kind of, the role as Child Life, it's weird. We go from doing, you know, helping with a bereavement, and then going to play with a kid and doing medical plan, prepping them for a procedure. You just kind of have to compartmentalize a little bit and turn a switch.
Yeah.
And a lot of it's just learning coping skills for yourself. I teach coping skills to kiddos every day to get through the ED process. So using those coping skills with myself, taking mental health time for myself, you know, self-care is big.
Because that stuff is heavy.
Yes.
Normally, you guys, like, you get donations.
Yes.
In December.
Yeah, around Christmas time, we get a lot.
And you guys have to live off those same toys for the rest of the year?
So, with COVID, pre-COVID, we had activity rooms where kiddos could leave the room, come hang out in the activity room, have different toys to play with. We would, of course, give out prizes for incentive, or, you know, you're doing a great job, also for development. But we're giving out a lot more toys now.
So
all the toys out now.
So basically every patient gets a toy. Pretty close.
Sort of, yeah, close enough. But they get to keep the toy because we can't lend out toys anymore. So the toys we give out and they keep. So they can't really use the toys that we had in the playroom to take to their room for a little while and come back, you know, COVID restrictions. So we've kind of gone through a lot of our donations quickly because we don't have that capability to lend out toys anymore.
So if you guys think this is like the type of like support this work, they could always use more.
We can always use more toys and more donations. We will always appreciate it, and all of our patients and families would for sure appreciate it. You know, those Christmas donations are starting to run out in July.
Well, I guess it's not a lot of people know about Child Life and the work that you guys do. But hopefully now, more people about how awesome these folks are.
We can always use more support.
Hey, Dr. Iyer.
Hi.
These are all the exam rooms. They treat you and give you medicine to make you feel better. This is where I got stuck in here, right in the port. See, they use magic cream. They put it right here, and then you don't feel a thing. Sometimes you just feel a little thing, but that's it. And this is where most patients go in when they're sick